Do you frequently feel like your heart aches sometimes? Or maybe you're often tired even after a full night's sleep? What if your eyes get red and blurry for no clear reason? These could just seem like small issues, but together, they might point to something deeper, like sarcoidosis. Sarcoidosis is a disease where tiny clumps of immune cells, called granulomas, form in your organs. Think of it like your body's defense system, going into overdrive and accidentally building roadblocks in places like your lungs, skin, or heart. It's rare, but it can affect anyone, and often strikes between ages 20 and 40. The tricky part, some people don't feel any symptoms at all, while others struggle daily. So, if you've had unexplained rashes, breathlessness, or joint pain, it might be time to look deeper. What causes sarcoidosis? Well, scientists still don't know the exact reason, but think of it like a false alarm in your immune system. Imagine your body is a security team, and instead of attacking only real threats like germs, it starts reacting to something harmless, like dust or pollen, and creates inflammation anywhere, like in your lungs or liver. It might be a mix of your genes and things in your environment. For example, if your dad had autoimmune issues and you work in a place with lots of mold or smoke, your risk might go up. It's not contagious, so you can't catch it from someone, but if your body is wired to overreact and you're exposed to the right or wrong triggers, sarcoidosis might develop. How would you know if you have it? Well, signs depend on which organs are affected. Most commonly, it hits the lungs. So, if you're climbing stairs and suddenly gasp for air, or have a dry cough that won't go away, even if you're healthy, that's a red flag. Some people get raised red skin patches, like on the shins. Imagine bug bites that never go away. Others feel tired all the time, like their battery is stuck at 10%. Some have swollen lymph nodes, like a lump in the neck that doesn't hurt. And in rare cases, it affects the eyes, blurry vision, or heart, fast or uneven heartbeat. Here's a quick self-check. Have you had a fever for weeks without infection, joint pain like arthritis? If yes, talk to your doctor. It could be sarcoidosis whispering through these clues. Diagnosing sarcoidosis is like being a detective. Your doctor won't find it in just one test. They'll ask about your symptoms, do a chest X-ray, to see if your lungs have shadows or swollen glands, and maybe a CT scan for a closer look. They might take a small tissue sample, a biopsy, from your lung or skin to check for those tiny granulomas under a microscope. Blood tests can show high calcium or inflammation markers. Now, treatment, not everyone needs it. Some people get better on their own. But if symptoms are severe, doctors use medicines to calm the immune system, like corticosteroids, for example prednisone. Think of them as peacekeepers that stop your body from attacking itself. For long-term cases, other drugs help reduce side effects. The key is regular checkups, to catch any organ damage early, and working closely with your doctor to adjust treatment as needed. Can you prevent sarcoidosis? Right now, there's no clear way to stop it before it starts, because we don't know the exact cause. But you can lower your risk by protecting your body. Avoid smoking. Your lungs are already a common target, so don't give them extra stress. Wear a mask if you work around dust chemicals or mold. Eat healthy foods like greens, nuts, and fish to keep your immune system balanced, not overactive. Stay active. Exercise helps your lungs and heart stay strong. And most importantly, listen to your body. If something feels off for more than a few weeks, get it checked. Prevention here is about being proactive, not perfect. Good news, research is moving forward. Scientists are now using advanced genetic testing to find which genes might make people more likely to get sarcoidosis. They are also studying immune system signals, like proteins called cytokines, to develop new drugs that target only the overactive parts, fewer side effects. Some trials are testing biologics, powerful lab-made antibodies that switch off bad immune responses. Also, doctors are learning that sarcoidosis isn't one disease, but maybe a group of similar conditions. so treatment can be more personalized. Imagine a future where a simple blood test tells your doctor exactly which medicine will work best for you. That's where we're heading, closer to faster diagnosis, better treatment, and maybe even prevention one day.